I did my project on exercise programs for amputees. And just a little overview on amputation. When a limb goes into limb deficiency, it usually has to be amputated. Limb deficiency is usually caused by vascular complications. So, whenever there's no blood flow to a region for a long enough period of time, that part of the body actually dies and it has to be amputated. You can't really bring it back. There's not much you can do. And vascular complications can be caused by a number of things. One of the biggest things that we see nowadays is actually diabetes, and it's usually type 2 diabetes, but diabetes can actually cause lower limb amputations, more specifically big toes. That's usually how it starts, is having to have a toe amputated, and then if it gets worse, the rest of the limb can be amputated. But it can also happen through traumatic accidents like car accidents, military service members that have accidents happen in war, work-related accidents. A big work-related accidents that therapists see right now is frostbite, especially just because it's so cold outside, but also like construction workers, warehouse workers, grocery store workers. If they don't have the proper equipment, especially grocery store workers, when they go into like a deep freeze or something, they can lose blood flow to their extremities and it can cause amputation. And also, unfortunately, things like cancer, more specifically like bone cancer, can cause a lot of amputations. So there's a lot of benefits of exercise for amputees. There's physical benefits and there's mental benefits. The physical benefits are strength, aerobic fitness, and balance. Probably the most important one is balance, especially for lower limb amputees, because they now are navigating on one limb instead of two, and their body is having to figure that out. They need a lot of strength in their one limb now to kind of help balance their body out, and they also are going to need a lot of strength in their residual muscle mass of the amputated side, because they're going to need strength to learn how to use the prosthetic and be able to support themselves on the prosthetic. It's also really important for them to have aerobic fitness, because a lot of times when amputees first start out, they are really sedentary and it's not good for them. They really need to get their blood flowing, just so that vascular complications don't happen again. And also for patients with diabetes, it's really important to get their aerobic fitness up, because excuse me, because they can have complications again with their diabetes. It's really important for them to start losing weight, eating healthier, becoming more active, getting their heart rate up, so that they don't have more complications with their diabetes. There can also be a lot of mental benefits for amputees too, especially service members. They struggle with things, such as PTSD, and it's also really hard to kind of accept that your limb is gone now. It's hard for a lot of patients to look in the mirror and just feel good about themselves. So exercise can help them feel really good about themselves, help with their self-esteem. It can also just help them feel capable again, like they're able to do normal things that they used to do, go on walks with their families, help out with chores around the house, just normal everyday things that a lot of people take for granted. Okay, so the exercise recommendations for amputees. This will honestly vary with all amputees, but for this one, I just kind of did like a lower limb amputee. So I did cardiovascular training 3 to 4 days a week, strength training 2 days a week, and neuromotor skills 2 to 3 days per week. And the neuromotor skills are just kind of helping with that brain-body connection. A lot of the times whenever an amputee has an amputation, it's sudden, especially with traumatic incidents, and their brain doesn't really have time to process that the limb is gone, so they can have a lot of things happening that may throw off their balance, throw off their mental state, have things like phantom pains where they think their limb is still there. So the neuromotor skills really help with just like the brain-body connection and helping them navigate their new body. So duration, Cardiovascular would be 30 minutes, strength training would be 45 minutes, and neuromotor skills would be 30 minutes. And all intensities just progress as the amputee progresses. Um, Obviously, their intensity is going to be low whenever they first start out. And as they get a prosthetic and they start learning how to use it and they become really good with it, the intensity can go really as high as they are capable of going and as much as they want to push themselves. So modes of exercise, cardiovascular, weight bearing, they can do walking or cycling, just like with a freestanding bike. And non-weight bearing, they can do a stationary bike where they sit. They can also do like an arm cycle ergometer. Strength training, they can do squats, they can do step-ups, they can do deadlifts. And as they progress, all of these strength training can get heavier. So you can do squats with a barbell, you can do step-ups with dumbbells, you can do deadlifts with the barbell, or you can just start from the beginning. You can get them to do it with like a PVC pipe, or dumbbells, or just like small weights, even like ankle weights. And neuromotor training, they do things a lot in therapy, like walking around cones, almost like you see the dogs do, like in the dog shows. But it really does help kind of learning how to navigate around them and how to like transition your body weight from one limb to the other. There's also like different types of foam that they can balance on, and also like this board that kind of looks like a seesaw. You put one foot on each end and you kind of just learn how to shift your weight. And what he's standing on in the picture is actually a Batsu ball, and it's like a yoga ball cut in half, and you can stand on it, and it really helps with your balance. You can also help with your agility, like people can toss a ball to you while you're standing on it. That also helps with neuromotor skills, kind of thinking about two things at once. Okay, and there are actually a lot of special considerations for amputees. So one thing is the residual muscle mass. We always have to think about that. We have to really think about it getting stronger. And whenever you're working with an amputee patient, you always want to start working with the residual muscle mass first. You never just want to go straight into the prosthetic, and they're not going to have the prosthetic right away. So you want to do as much as you can with the residual muscle mass. They also are going to have things like phantom pains. So they may be working out and be like, oh, my leg, and their leg's not there. It may be a problem with the prosthetic. It may just be rubbing the nerve endings on the bottom of the amputation, and it may cause their brain to think that the limb is still there and that it's in pain. A lot of things that can help with this are also psychological therapy and medication. A lot of amputees get put on depression medication, and it really does help with their motivation, helping them feel more capable. And, if they feel more capable mentally, they're going to be ready to go whenever it comes to therapy and exercising and working out. So that really helps a lot. Also, just learning how to use their prosthetic, that's a big thing. You can't just put on a prosthetic and go. It doesn't really work like that. It takes a lot of trial and error. You may get one prosthetic and it may not work for you, and you may get another prosthetic and it may work for you, but it may take time to work. And just learning how your body wants to use it. It's also important to note that you can't use your prosthetic all day, every day. You do need to take it off sometimes and give your body a break, especially in the beginning, because your body is not used to this new prosthetic yet. So you have to give your body time to adjust and use it in small amounts first, and you can eventually learn to go longer with the prosthetic and use it more. And then another thing that really helps is group exercise and group therapy, because it helps the amputees know that they're not alone and that there's someone else out there who's going through the same struggles as them, and that they have someone to talk to. It's really good to help build a sense of community and help them know that they're not alone. Okay, and these are the references.